Treatment for PTSD takes place in a variety of settings. Outpatient clinics with weekly care and individual and group treatment options, residential programs where people live in and participate in additional activities alongside treatment, and lastly, inpatient hospital treatment, providing ongoing medical attention for veterans who are suicidal or require more intensive care. The right option for your loved one will depend on their symptoms and how much these are impacting their life. An assessment with a provider will give you a recommendation for the type and level of care your veteran might need. Being aware of the different treatment options available is one of many ways you can help your loved one with PTSD. The treatments we will share have been thoroughly researched and are effective in decreasing symptoms of PTSD. They are strongly recommended by the American Psychological Association for the treatment of PTSD, are typically delivered over a 3 to 5 month period, and can improve symptoms quite quickly. Prolonged exposure therapy, or PE, is a cognitive behavior treatment typically delivered over 12 weeks in 90-minute sessions. PE teaches veterans how to talk through and confront painful memories, feelings, and situations they have avoided since the trauma. PE has 2 components, imaginal exposure and in vivo exposure. Imaginal exposure encourages the veteran to expose themselves to the memories they have been avoiding or experiencing as intrusions. They are recorded talking through the memory and recalling as many details as possible. This may be repeated several times in the session. Afterwards, the therapist and the veteran will explore their thoughts, feelings, and reactions to the memories shared. The veteran is then asked to listen to the recording of themselves talking about the memory every day in between sessions. Imaginal exposures enable the veteran to emotionally process the trauma and get a better perspective on it. They learn that remembering a trauma and experiencing emotions will not harm them. This results in becoming less fearful of other situations that remind them of their trauma, and over time, the distress associated with the trauma memory is reduced. In vivo exposure, meaning in life, encourages the veteran to face situations they have avoided because they remind the veteran of the trauma or cause emotional distress. With their therapist, they will list all the places, sounds, smells, and people that cause them distress, and then rank them based on how distressing they are. They choose 1 to 2 items at a moderate level of distress to engage in several times a week, gradually working up to the more challenging ones over the course of treatment. The goal is for the veteran to eventually experience less distress when engaging in these activities, and then they can participate more fully in their life. PE is very effective for decreasing PTSD symptoms. However, since it asks people to approach difficult experiences, it can be experienced as quite distressing for the veteran, and PTSD symptoms may sometimes worsen before they improve. This is because the veteran will be facing the experiences, thoughts, and feelings which they have avoided for so long. Another treatment option is cognitive processing therapy, or CPT. CPT is a 12-session cognitive behavioral therapy typically delivered weekly in individual or group sessions lasting 50 to 60 minutes. CPT focuses on helping the veteran recognize how their experiences of trauma have resulted in negative thoughts about themselves, others, and the world. In CPT, these thoughts are referred to as stuck points because they keep people stuck and interfere with recovery from PTSD. The treatment incorporates worksheets to help the veteran get unstuck from these thoughts by learning how to think through, challenge, and modify them, and then consider new, more balanced perspectives. In addition to PE and CPT, the American Psychological Association also recommends cognitive behavior therapy and cognitive therapy for PTSD. In these treatments, veterans are taught to understand the relationship between their thoughts, emotions, and behaviors, learn new patterns of thinking, and practice new positive behaviors. Eye movement desensitization and reprocessing, EMDR, is another suggested therapy that works with negative thoughts, feelings, and bodily sensations related to trauma memories. A back-and-forth movement or sound is played to the veteran while they are thinking about the traumatic memory until the distress decreases. Eventually, a positive belief and feeling is associated with the memory. Since PTSD symptoms impact veterans' loved ones as well, family or couples therapy can also help treat PTSD symptoms. If you and your veteran think this may be of help, you can speak with your veteran's therapist about what possibilities may be available. Finally, there are also medication options effective in treating PTSD symptoms when used in conjunction with the therapies we've discussed. The medications generally do not get rid of symptoms, but they may make them less intense and more manageable, which can help a veteran more effectively engage in their therapy. The FDA has approved only paroxetine, Paxil, and sertraline, or Zoloft, for treating PTSD. However, because people respond differently to medications, experience different symptoms of PTSD, and may have other comorbid mental health or medical diagnoses, a doctor may prescribe other medications instead. Additionally, there are medicines that have been found to treat specific symptoms or related issues, such as prazosin, or Minipress, for insomnia and nightmares. The right medication will depend on an individual's symptoms, reactions, and their medical history. It is therefore important for a veteran to speak with their doctor before starting a medication.